July 2024, Sacramento General Hospital. Something deeply troubling was happening in room 314 of the neonatal intensive care unit, and pediatric nurse Rebecca Torres couldn't shake the feeling that baby girl Henderson was in danger from the very people who claimed to be her parents. The fluorescent lights hummed softly as Rebecca began her shift that humid Tuesday morning. With 12 years of pediatric nursing experience, she had seen nearly everything that could bring a newborn to the NICU. But this case felt different in ways that made her stomach tighten with concern. Baby girl Henderson had been born at 36 weeks, officially premature but not critically so. Her medical chart indicated standard complications associated with early delivery, slightly underdeveloped lungs and feeding difficulties. What troubled Rebecca wasn't the baby's condition, which was improving steadily, but rather the inconsistencies she had noticed in the family's story and behavior. The baby's mother, Jessica Henderson, was listed as 28 years old, married, and this was supposedly her first child. She had given birth 3 days earlier, but her interactions with the baby seemed oddly distant for a new mother. During Rebecca's previous shifts, she had observed Jessica holding the infant with a stiffness that suggested unfamiliarity rather than the natural awkwardness of a first-time parent. More concerning was the fact that Jessica's husband, David Henderson, had only visited once since the birth, staying for less than 30 minutes, and appearing visibly uncomfortable around the baby. When Rebecca had tried to engage him in conversation about feeding schedules and care instructions, he had deferred all questions to his wife, claiming he wasn't good with medical stuff. Rebecca had been a pediatric nurse long enough to recognize when something didn't feel right. Her training had taught her to trust her instincts, especially when it came to protecting vulnerable patients. The safety protocols at Sacramento General emphasized the importance of being observant not just of medical conditions, but of family dynamics that might indicate concerning situations. As she checked on baby girl Henderson during her morning rounds, Rebecca noticed that Jessica was holding the infant but staring out the window, rather than looking at her daughter. The baby was fussing slightly, but Jessica didn't seem to register the sounds or adjust her hold to comfort the child. "How are you feeling this morning, Jessica?" Rebecca asked gently, approaching the bed with a warm smile. "Is she feeding well?" Jessica looked up with a startled expression, as if she had forgotten where she was. "Oh yes, she's fine." "Everything's fine," she said quickly, but her voice lacked the confidence Rebecca typically heard from mothers discussing their babies. Rebecca had learned over the years that "everything's fine" was often code for the opposite. She sat down in the chair next to Jessica's bed, maintaining the caring but professional demeanor that had made her one of the most trusted nurses in the NICU. "Being a new mom can be overwhelming," Rebecca said. "It's completely normal to feel uncertain about things. Is there anything specific you'd like to talk about regarding the baby's care?" Jessica's eyes filled with tears, but she quickly wiped them away. "I'm just tired, I guess. It's all so new." She paused, then added quietly, "David thinks we should name her Emma. What do you think?" The question struck Rebecca as odd. Most parents arrived at the hospital with names already chosen, or at least with strong preferences. The fact that Jessica was asking a nurse for naming advice suggested a level of detachment that was concerning. "Emma is a beautiful name," Rebecca replied. "Have you and David discussed other options?" "Not really," Jessica said, shifting the baby to her other arm with movements that seemed practiced but emotionally distant. "David makes most of the decisions about important things." Rebecca made a mental note of this response. While many couples had different approaches to decision-making, Jessica's tone suggested something beyond normal marital dynamics. Combined with David's minimal involvement and Jessica's apparent uncertainty about basic parenting decisions, Rebecca was beginning to suspect that this family situation was more complex than it appeared on the surface. After completing her rounds, Rebecca returned to the nurse's station and pulled up baby girl Henderson's file on the computer. She reviewed the admission paperwork carefully, looking for details she might have missed during previous shifts. The birth certificate listed Jessica and David Henderson as the parents, with an address in a suburb of Sacramento. Jessica's medical history indicated this was her first pregnancy, with prenatal care provided by Dr. Patricia Williamson at a clinic across town. Something about the medical history bothered Rebecca, though she couldn't immediately identify what was troubling her. She had worked with hundreds of first-time mothers, and while each woman's experience was unique, there were certain patterns of behavior and knowledge that typically emerged. Jessica seemed to lack the basic familiarity with infant care that most women develop during pregnancy through reading, classes, or conversations with other mothers. Rebecca decided to call Dr. Williamson's office to clarify some details about Jessica's prenatal care. As a standard practice, NICU nurses often followed up with obstetricians to ensure continuity of care and to address any concerns about the transition from pregnancy to motherhood. The receptionist at Dr. Williamson's office was helpful but provided information that deepened Rebecca's concerns. According to their records, Jessica Henderson had only had 3 prenatal appointments, all within the last 6 weeks of pregnancy. This was highly unusual for a first-time mother, who typically began regular prenatal care much earlier in pregnancy. When Rebecca asked to speak with Dr. Williamson directly, she was told the doctor was with a patient but would return her call within the hour. Rebecca left her contact information and a message indicating she had questions about continuity of care for a patient who had recently delivered. While waiting for Dr. Williamson's return call, Rebecca continued her regular duties, but found herself checking on baby girl Henderson more frequently than usual. During her afternoon visit to room 314, she discovered Jessica talking on her cell phone in what appeared to be a tense conversation. "I told you I can't do that right now," Jessica was saying, in a low voice. "The nurses are always watching. We need to wait until—" She noticed Rebecca entering the room and quickly ended the call. "I'm sorry," Jessica said, putting her phone away. "That was just my sister. She's excited about the baby." Rebecca nodded and proceeded with her routine checks of the baby's vital signs and feeding chart. Baby girl Henderson was thriving physically, gaining weight appropriately, and showing no signs of the respiratory distress that sometimes affected premature infants. From a medical standpoint, she would likely be ready for discharge within the next few days. "Dr. Martinez will probably want to discuss discharge planning with you tomorrow," Rebecca told Jessica. "Is your home ready for the baby? Do you have all the supplies you need?" Jessica's response was vague and seemed rehearsed. "David has been taking care of all that. He's very organized about those kinds of things." Rebecca had noticed that Jessica consistently deferred questions about practical matters to her absent husband. While some couples did divide responsibilities this way, the pattern seemed extreme in this case, especially given David's minimal presence at the hospital. As her shift neared its end, Rebecca received the return call from Dr. Williamson. The conversation that followed confirmed her growing suspicions that something was not right with the Henderson family situation. "I remember Jessica Henderson," Dr. Williamson said. "She was referred to us by the emergency room after presenting with advanced pregnancy. She claimed she didn't realize she was pregnant until very late in the process, which can happen but is uncommon with a full-term pregnancy." Dr. Williamson continued, "What concerned me was her lack of knowledge about basic pregnancy and childbirth information. She seemed genuinely surprised by routine questions about due dates, previous pregnancies, and family medical history. I recommended parenting classes and additional support services, but she declined all of them." Rebecca thanked Dr. Williamson for the information and promised to keep her updated on the baby's progress. After ending the call, she sat at her desk reviewing everything she had observed and learned over the past 3 days. The pattern that was emerging suggested that Jessica Henderson might not be who she claimed to be, or that the circumstances surrounding baby girl Henderson's birth were far more complicated than the medical records indicated. According to hospital protocol, Rebecca's next step was to document her concerns and discuss them with her supervisor, charge nurse Patricia Collins. Patricia had been working in pediatric care for over 20 years and had developed an excellent reputation for handling delicate situations involving child welfare concerns. Rebecca found Patricia in the break room, reviewing staffing schedules for the following week. Patricia looked up as Rebecca approached, immediately sensing from her expression that this wasn't a routine conversation. "What's on your mind, Rebecca?" Patricia asked, setting aside her paperwork and giving her full attention. Rebecca outlined her observations about the Henderson family, being careful to stick to facts rather than speculation. She described Jessica's behavior, David's minimal involvement, the inconsistencies in the prenatal care timeline, and the concerning phone conversation she had partially overheard. Patricia listened carefully, occasionally asking clarifying questions. As a charge nurse, she had handled similar situations before, and understood the delicate balance between respecting family privacy and ensuring child safety. "What's your gut telling you?" Patricia asked, when Rebecca finished her summary. "My gut is telling me that baby girl Henderson might be in a situation that requires closer attention," Rebecca replied. "I can't prove anything specific, but too many things don't add up to a normal family dynamic." Patricia nodded thoughtfully. "I think you're right to be concerned. Let's document everything you've observed and schedule a care conference for tomorrow morning. I'll invite Dr. Martinez, the social worker, and security. We need to explore this situation more thoroughly before we consider discharge." Rebecca felt a sense of relief knowing that her concerns were being taken seriously. The hospital's commitment to patient safety meant that even subtle warning signs were investigated thoroughly. Child protection was everyone's responsibility, and the medical team worked together to ensure that no vulnerable patient left the hospital in an unsafe situation. As Rebecca prepared to end her shift, she made one final check on baby girl Henderson. The infant was sleeping peacefully in her bassinet, unaware of the complex situation surrounding her birth and early days of life. Jessica was also asleep in the hospital bed, exhaustion evident on her face. Standing in the quiet room, Rebecca reflected on the importance of trusting professional instincts and maintaining vigilance even in seemingly routine situations. Her 12 years of experience had taught her that some of the most important interventions began with subtle observations and a willingness to ask difficult questions. Tomorrow's care conference would determine the next steps in ensuring baby girl Henderson's safety and well-being. Rebecca was committed to being an advocate for her patient, even if it meant challenging assumptions and questioning what appeared to be a normal family situation. The nursing profession had taught Rebecca that healing extended beyond medical care to include protecting vulnerable individuals from harm. As she gathered her belongings and prepared to leave the hospital, she knew that her observations over the past 3 days might be the key to ensuring that baby girl Henderson received not just excellent medical care, but also the safety and security that every newborn deserved. The fluorescent lights continued to hum softly in the NICU as the night shift nurses took over care of the precious infants. Rebecca's documentation and recommendations would set in motion a process designed to protect children and support families, demonstrating how one nurse's commitment to patient advocacy could make all the difference in a vulnerable child's life. Rebecca arrived at Sacramento General Hospital early the next morning, 30 minutes before her scheduled shift. The care conference was set for 8 a.m., and she wanted to review her notes one more time before meeting with the medical team. As she walked through the familiar corridors of the NICU, she felt a mix of anticipation and concern about what the day might reveal. The conference room on the 3rd floor was already occupied when Rebecca arrived. Charge Nurse Patricia Collins was setting up files at the head of the table, while Dr. Elena Martinez, the attending pediatrician, reviewed baby girl Henderson's medical chart. Also present was Maria Santos, a social worker from the hospital's child protection team, and Officer James Thompson from the Sacramento Police Department's Family Services Unit. "Thank you all for being here," Patricia began as Rebecca took her seat. "Rebecca has observed some concerning patterns with the Henderson family that warrant our attention. Rebecca, would you please walk us through your observations?" Rebecca presented her findings methodically, starting with Jessica's detached behavior toward the baby and progressing through the inconsistencies in prenatal care and the concerning phone conversation. She was careful to distinguish between facts and her professional intuition, but emphasized that her 12 years of experience had taught her to recognize when family dynamics raised red flags. Dr. Martinez had been listening intently, occasionally making notes in the margin of the medical chart. From a medical standpoint, baby girl Henderson is thriving, she said. Her premature birth wasn't severe, and she's responded well to treatment. However, I have noticed that the parents seem unusually unfamiliar with basic newborn care procedures. Maria Santos leaned forward in her chair. I've had preliminary contact with the family, but only briefly during admission. What struck me was Jessica's lack of questions about discharge planning and community resources. Most new mothers, especially first-time mothers, are eager for information about pediatricians, support groups, and parenting resources. Officer Thompson had been quietly reviewing a folder during the discussion. He looked up as Maria finished speaking. I ran a background check on David and Jessica Henderson using the information from their hospital registration. The address they provided exists, but it's a rental property that has been vacant for the past 6 months according to county records. This revelation sent a chill through the room. Rebecca felt her suspicions crystallizing into genuine concern for the baby's safety. Patricia made a note on her pad and looked around the table. Given this information, I think we need to approach this situation more systematically, Patricia said. Our primary obligation is to the safety and welfare of baby girl Henderson. Maria, what are our options for ensuring her protection while we investigate further? Maria had handled similar cases before and was well versed in the protocols designed to protect vulnerable children. We can implement a medical hold, which would prevent discharge until we've resolved our concerns about the family situation. This gives us legal authority to keep the baby safe while we gather more information. Dr. Martinez nodded in agreement. I can justify the medical hold based on the need for extended observation of her feeding patterns and weight gain. That will give us at least 48 to 72 hours to investigate without raising immediate suspicion with the family. Officer Thompson offered his department's assistance. I can work with social services to investigate the Henderson identity further. We'll check marriage records, employment verification, and try to trace their background more thoroughly. If there are criminal aspects to this situation, we need to identify them quickly. Rebecca appreciated how seriously the team was taking her concerns. The hospital's commitment to child protection meant that even uncertain situations were thoroughly investigated. What should I do during my interactions with Jessica today? She asked. I don't want to make her suspicious, but I also want to gather any additional information that might be helpful. Patricia considered this carefully. Continue your normal nursing duties and maintain your professional relationship with her. If she volunteers information, listen carefully and document everything. But don't ask probing questions that might make her defensive or cause her to leave the hospital prematurely. The team agreed to reconvene at the end of the day to share their findings. As the meeting concluded, Rebecca felt a sense of purpose knowing that her observations were being taken seriously and that a professional network was working to protect baby girl Henderson. Returning to the NICU, Rebecca began her regular shift duties, but with heightened awareness of every interaction with the Henderson family. Her first stop was room 314, where she found Jessica sitting in the chair beside the baby's bassinet, staring at her cell phone rather than attending to her daughter. "Good morning, Jessica," Rebecca said cheerfully. "How did the night go? Did Emma feed well?" She had decided to use the name Jessica had mentioned the day before, hoping to encourage more conversation. Jessica looked up with what seemed like relief at seeing a familiar face. "She cried a lot during the night," Jessica said. "The night nurse had to help me figure out how to calm her down. I guess I'm still learning." Rebecca noticed that Jessica referred to learning about her own baby as if she were babysitting someone else's child. The emotional distance was becoming more apparent with each interaction. "Every baby is different," Rebecca said supportively. "Some babies need more time to adjust to life outside the womb." "Has David been able to visit this morning?" "He had to work," Jessica replied quickly. "He said he'll try to come by later, but his schedule is really busy this week." Rebecca found it odd that a new father would prioritize work over spending time with his premature daughter, especially during her first week of life. Most fathers, even those uncomfortable around newborns, made an effort to be present during the hospital stay. As Rebecca performed her routine assessment of the baby, she noticed that Jessica watched the procedures with the intensity of someone trying to memorize unfamiliar tasks rather than the natural curiosity of a mother learning about her child's care. "Would you like me to show you how to check her diaper?" Rebecca offered. "It's something you'll be doing a lot once you take her home." Jessica hesitated before agreeing, and her movements during the diaper change were awkward in a way that suggested complete inexperience rather than normal new mother nervousness. Rebecca had taught hundreds of new mothers this basic skill, and Jessica's response was unlike anything she had encountered before. During her break, Rebecca called the rental office for the property listed as the Hendersons' address. Posing as a friend trying to reach them, she learned that the house had indeed been empty for months and was currently being renovated. This confirmed Officer Thompson's findings and deepened the mystery surrounding the family's true identity. Rebecca also took the opportunity to review the NICU's security footage from the past few days. Hospital policy required that all patient areas be monitored for safety purposes, and Rebecca hoped the recordings might provide additional insights into the family's behavior when they thought they were unobserved. The security supervisor, Tom Bradley, was cooperative and understanding when Rebecca explained that she was working with the medical team on a patient safety concern. Together, they reviewed footage from Jessica's room and the common areas where families typically gathered. The recordings revealed several interesting details. During David's single visit, he had spent most of his time on his cell phone, rather than interacting with Jessica or the baby. When he did hold the infant, his movements were stiff and uncomfortable, more like someone fulfilling an obligation than a father bonding with his child. More concerning was footage from late the previous evening, when Jessica thought she was alone. Instead of the exhausted but loving behavior typical of new mothers, Jessica had paced the room while talking on her phone, occasionally glancing at the baby as if she were a problem to be solved rather than a cherished child. "There's something else you should see," Tom said, advancing the footage to a recording from earlier that morning. This was taken in the parking garage around 6 a.m. The screen showed Jessica meeting with a woman in a dark sedan. The conversation appeared tense, with both women glancing around nervously as they talked. Jessica handed the woman what appeared to be documents, and the woman gave Jessica an envelope in return. The entire exchange lasted less than 5 minutes, but it had the appearance of a clandestine transaction. Rebecca felt her heart rate increase as she watched the footage. Whatever was happening with baby girl Henderson, it clearly involved more people than just Jessica and David. The secretive meeting suggested a level of planning and coordination that elevated her concerns about the baby's safety. She immediately called Patricia to report this new development. Within minutes, Patricia had notified Officer Thompson, who requested a copy of the security footage for police investigation. The situation was rapidly evolving from a case of concerning family dynamics to what appeared to be a potentially criminal matter. When Rebecca returned to her duties, she found Dr. Martinez examining baby girl Henderson while Jessica watched anxiously. The baby was healthy and showing no signs of distress, but Dr. Martinez was being thorough in her assessment. "Everything looks good," Dr. Martinez told Jessica. "Her weight gain is excellent and her breathing is strong. We'll want to monitor her for another day or two just to be completely sure she's ready for home care." Rebecca noticed Jessica's reaction to the news that discharge would be delayed. Instead of the disappointment or concern that most mothers would show, Jessica seemed almost relieved. This reaction reinforced Rebecca's suspicion that something was preventing Jessica from wanting to take the baby home. As the afternoon progressed, Rebecca paid careful attention to Jessica's phone conversations, though she was careful not to appear to be eavesdropping. She overheard fragments of conversations that suggested Jessica was reporting to someone about the baby's condition and the hospital's discharge timeline. During one call, Rebecca heard Jessica say, "They want to keep her another day. I can't control that. No, I can't just leave with her. There are too many people watching. The implication that Jessica felt she was being watched, combined with her apparent reluctance to take the baby home, painted a picture of someone caught in a situation beyond her control. Rebecca began to wonder if Jessica might be as much a victim as baby girl Henderson. Officer Thompson arrived at the hospital late in the afternoon to update the team on his investigation. The news he brought confirmed their worst fears about the Henderson family situation. David and Jessica Henderson are not who they claim to be, he announced. The names are aliases, and we haven't been able to trace their real identities yet. The credit card used for hospital registration was reported stolen 3 weeks ago, though the theft wasn't discovered until yesterday. He continued. We're working with federal authorities because this situation has the characteristics of human trafficking or illegal adoption activities. The baby may have been intended for sale or illegal placement. Rebecca felt a chill as she realized that baby girl Henderson might have been born specifically to be separated from her biological mother and placed with people willing to pay for an infant. The thought that this innocent child had been brought into the world as part of a criminal enterprise was heartbreaking and infuriating. What's our next step? Patricia asked. We maintain the medical hold and continue normal care while we investigate further, Officer Thompson replied. We're setting up surveillance to see who Jessica contacts and where she goes when she leaves the hospital. We need to identify the other people involved in this operation. Dr. Martinez had been listening quietly, but now she spoke up. What about Jessica? If she's involved in illegal activity, but also potentially a victim, how do we handle that aspect? We're treating her as both a suspect and a potential victim until we know more, Officer Thompson said. She may have been coerced into this situation, or she may be a willing participant. Either way, our primary concern is the baby's safety. As Rebecca's shift ended, she felt emotionally drained but committed to seeing this situation through to a resolution. Baby girl Henderson was depending on the medical team to protect her, and Rebecca was determined not to let her down. The investigation was expanding beyond the hospital walls, but Rebecca knew her role was to continue providing excellent medical care while remaining vigilant for any changes in Jessica's behavior or any new information that might help resolve the case. Walking to her car in the hospital parking garage, Rebecca thought about the security footage of Jessica's early morning meeting. Tomorrow would bring new developments, and she hoped they would lead to answers that would ensure baby girl Henderson's safety and well-being. The baby deserved a chance to grow up in a loving, safe environment, and Rebecca was committed to doing everything in her power to make sure that happened. Rebecca arrived at the hospital the next morning to find the NICU buzzing with unusual activity. Security personnel were stationed at strategic points throughout the unit, and she noticed federal agents in suits speaking quietly with hospital administrators near the nurse's station. The investigation into baby girl Henderson's situation had clearly escalated overnight. Charge, Nurse Patricia Collins intercepted Rebecca as she headed to the locker room. We need to talk before you start your shift, Patricia said, guiding her to a private office away from the main floor activity. There have been significant developments in the Henderson case. Inside the office, Rebecca found Officer Thompson and a woman she didn't recognize. Agent Sarah Kim from the FBI's Human Trafficking Task Force. Agent Kim's presence confirmed Rebecca's worst fears about the scope of what they were dealing with. Agent Kim will brief you on what we've learned, Patricia said, taking a seat beside Rebecca. Agent Kim opened a file folder and spread several photographs on the desk. The woman you know as Jessica Henderson is actually Maria Santos, age 24, from Los Angeles. She has a history of minor criminal activity, mostly related to substance abuse, but no violent offenses. We believe she was recruited specifically for this operation because of her personal circumstances. Rebecca studied the photographs, which showed a younger-looking woman with different hair color and style. Recruited for what exactly? We're investigating an illegal adoption ring that targets pregnant women in vulnerable situations, Agent Kim explained. They offer money, housing, and health care in exchange for the women agreeing to give up their babies to specific buyers. The operation we're tracking has been active across multiple states for at least 2 years. Officer Thompson leaned forward. Maria Santos was living on the streets in LA when she was approached 6 months ago. According to our investigation, she was offered $15,000 in temporary housing to carry a pregnancy to term and surrender the baby to predetermined adoptive parents. Rebecca felt sick as the full scope of the situation became clear. So baby girl Henderson isn't even Maria's biological child. That's where it gets more complicated, Agent Kim said. Preliminary DNA testing suggests that Maria is the biological mother, but we believe she was artificially inseminated as part of the arrangement. The buyers specifically wanted a baby with certain physical characteristics, and Maria was selected to be the surrogate. The revelation that baby girl Henderson had been conceived specifically for sale made Rebecca's professional instincts surge with protective anger. This innocent child had been treated as a commodity before she was even born. "What about the man calling himself David Henderson?" Rebecca asked. "David Mitchell, 35, from Phoenix." Officer Thompson replied. "He's the operational coordinator for this particular transaction. His job was to manage the logistics of the birth, hospital stay, and transfer of the baby to the buyers. He's done this at least 6 times in the past 18 months. Agent Kim pulled out another set of photographs. The buyers are Jonathan and Catherine Walsh from Seattle. They've been trying to adopt through legal channels for several years but were rejected due to financial instability and a history of domestic violence incidents. They turned to illegal adoption when legitimate agencies wouldn't approve them." Rebecca's heart sank as she realized that baby girl Henderson had been destined for a potentially dangerous home environment. "Where are the Walshes now?" "Under surveillance," Agent Kim said. "They're expecting to take custody of the baby within the next 48 hours. They've already paid $85,000 for what they believe is a private adoption arranged through legitimate channels." Patricia had been listening quietly, but now she spoke up. "What's our role in resolving this situation? Obviously, we can't allow the baby to be transferred to people who might harm her. We need to maintain normal operations while we gather evidence and identify all participants in the network," Agent Kim explained. "Maria Santos is cooperating with our investigation, but she's also frightened. The people running this operation have made it clear that there will be consequences if she doesn't fulfill her part of the agreement." Rebecca understood that Maria's apparent detachment from the baby wasn't necessarily due to lack of maternal feeling, but rather to the traumatic circumstances of the pregnancy and birth. "Is Maria being coerced to give up the baby?" "Yes and no," Agent Kim said. "She agreed to the arrangement voluntarily, but under circumstances that constitute exploitation. She was homeless, addicted, and desperate when she was recruited. The consent she gave may not be legally valid, given her vulnerable state at the time." Officer Thompson added, "We're also investigating whether other women in the network were coerced through threats or violence. This appears to be a sophisticated operation that preys on vulnerable women and desperate prospective parents." Rebecca felt overwhelmed by the complexity of the situation. Her instinct to protect baby girl Henderson remained strong, but she now understood that Maria Santos might also need protection and support. "What should I expect during my interactions with Maria today?" Rebecca asked. "She knows that law enforcement is involved, though she doesn't know the full extent of our investigation," Agent Kim replied. "She's agreed to continue playing her role as Jessica Henderson while we gather evidence against the operation's leaders. Try to be supportive without compromising the investigation." As Rebecca began her shift, she felt the weight of responsibility for both baby girl Henderson and Maria Santos. The baby remained in the NICU, thriving physically but unaware of the complex legal and ethical issues surrounding her birth and future. When Rebecca entered room 314, she found Maria holding the baby with what appeared to be genuine affection for the first time since the birth. The transformation was subtle but noticeable. Maria was looking at the baby's face, talking softly to her, and responding to her movements with appropriate maternal behaviors. "She's been more alert today," Maria said, looking up as Rebecca approached. "I think she's starting to recognize my voice." Rebecca felt a pang of sadness, knowing that this bonding between mother and child was occurring within the context of an illegal arrangement designed to separate them permanently. That's wonderful. Babies do start recognizing familiar voices very early. As Rebecca performed her routine assessment of the baby, she noticed that Maria was asking more specific questions about infant care feeding schedules, sleep patterns, and developmental milestones. The questions seemed to reflect genuine maternal concern, rather than the detached curiosity she had shown previously. "Have you thought more about the name Emma?" Rebecca asked gently. Maria's expression became conflicted. "I don't know if I should name her," she said quietly. "If she's going to have a different family, maybe they should choose her name." Rebecca recognized the pain in Maria's voice and realized that the young woman was struggling with the emotional reality of surrendering her biological child. "Every baby deserves a name from the person who brought her into the world," Rebecca said carefully. "That's a gift that only you can give her." Tears filled Maria's eyes. "I never expected to feel this way about her," she admitted. "When I agreed to this, I thought it would be easy to just hand her over and walk away. But now," Rebecca sat down beside Maria's bed, maintaining her professional demeanor while offering emotional support. "Becoming a mother changes everything, even when the circumstances are complicated. It's natural to feel conflicted about difficult decisions. The thing is," Maria continued, "I don't think I can give her a good life. I don't have money or a stable place to live. The people who want to adopt her can give her things I never could." Rebecca understood that Maria was trying to rationalize a decision that had been made under coercion and exploitation. Sometimes the most important thing a child needs is love and safety. Those don't require money or perfect circumstances. During her break, Rebecca met with Agent Kim to report on her conversation with Maria. The agent was particularly interested in Maria's apparent change in attitude toward the baby and her willingness to discuss her conflicted feelings. "We're prepared to offer Maria protective custody and support services if she's willing to testify against the operation," Agent Kim said. She would also retain custody of her daughter and receive assistance with housing, healthcare, and job training. Rebecca felt hopeful that there might be a positive resolution for both mother and child. "What are the chances that Maria will accept that offer?" "It depends partly on how frightened she is of the people running the operation," Agent Kim replied. "They've been very clear about the consequences of not fulfilling the agreement. Maria knows that keeping the baby would put both of them at risk." As Rebecca returned to her duties, she found David Mitchell in room 314, speaking intently with Maria. His presence in the NICU was the first time Rebecca had seen him since the day after the birth, and his demeanor seemed more urgent than during his previous visit. "The arrangements are finalized," David was saying as Rebecca entered the room. "You need to be ready tomorrow morning. The discharge will happen early, and the transfer needs to be completed quickly." Rebecca continued with her assessment of the baby while listening to the conversation. David's tone was businesslike and somewhat threatening, reinforcing Agent Kim's description of him as an operational coordinator rather than a supportive partner. "I need more time," Maria said quietly. "She's still so small, and I want to make sure she's really ready to leave the hospital." David's expression hardened. "The timeline isn't negotiable. Our clients have been very patient, and they're expecting to take custody tomorrow as agreed. Any delay could complicate the entire arrangement." Rebecca made eye contact with Maria and saw fear mixed with maternal protectiveness. The young woman was clearly torn between her obligations under the illegal agreement and her growing attachment to her daughter. After David left, Rebecca spent additional time with Maria, offering support while being careful not to influence her decision-making process inappropriately. "Whatever you decide about your daughter's future, the most important thing is that it's your decision," Rebecca said. "I don't know if I have a choice anymore," Maria replied. "Too many people are counting on this happening exactly as planned." Rebecca realized that Maria needed to understand that she did have alternatives, even if they involved risks. There are always choices, even in difficult situations. Sometimes the right choice is the hardest one to make. As her shift ended, Rebecca felt the tension building toward what would likely be a critical confrontation the following day. Agent Kim had indicated that federal agents would intervene before any illegal transfer could take place, but the timing would be crucial to ensure both Maria and the baby's safety. Baby girl Henderson continued to thrive in the NICU, unaware that her future hung in the balance between an illegal adoption arrangement and a law enforcement operation designed to protect her. Rebecca was committed to ensuring that whatever happened, the baby's welfare would be the primary consideration. The investigation had revealed the scope of a criminal enterprise that exploited vulnerable women and endangered children, but it had also shown the power of professional vigilance and interagency cooperation to protect those who couldn't protect themselves. Tomorrow would bring resolution to a case that had begun with a nurse's instinct that something wasn't right and had evolved into a federal investigation that could save both a mother and child from a dangerous situation. Rebecca arrived at Sacramento General Hospital before dawn, knowing that this would be the most critical day in baby girl Henderson's short life. The early morning hours were quiet in the NICU, but she could sense the tension that came with knowing that federal agents were positioned throughout the hospital, waiting for the illegal adoption transfer that David Mitchell had scheduled for later that morning. Agent Kim had briefed the nursing staff the previous evening about the planned intervention. The operation would need to unfold carefully to ensure the safety of both Maria Santos and her daughter, while gathering enough evidence to prosecute the entire trafficking network. Rebecca's role was to maintain normal patient care while being prepared to act quickly if the situation escalated. As Rebecca began her shift, she found Maria awake in room 314, holding her daughter and speaking softly to her in Spanish. The transformation in Maria's demeanor over the past few days had been remarkable. She had evolved from a detached woman fulfilling an obligation to a mother grappling with the most difficult decision of her life. "Buenos dias, Maria," Rebecca said gently, using the woman's real name for the first time. Agent Kim had authorized the nursing staff to acknowledge Maria's true identity as part of building trust for the upcoming intervention. Maria looked up with surprise and gratitude. "Thank you for calling me by my real name," she said. "I had almost forgotten what it felt like to be myself, instead of pretending to be someone else." Rebecca checked the baby's vital signs and found everything perfectly normal. Baby girl Henderson, or rather, baby girl Santos, was thriving and showed no signs of the medical issues that had originally justified keeping her in the NICU. From a medical standpoint, she was ready for discharge, which made the morning's events even more urgent. "How are you feeling about today?" Rebecca asked carefully, knowing that Maria was aware of the federal investigation, but uncertain about what would happen when David Mitchell arrived to complete the illegal transfer. "Scared," Maria admitted, "but also hopeful for the first time in months." Agent Kim explained that I might have choices I didn't know existed. I never thought I could keep my baby and still give her a good life. Rebecca sat down beside Maria's bed, offering the kind of emotional support that had always been central to her nursing practice. "What does your heart tell you about what's best for your daughter?" Tears filled Maria's eyes. "My heart tells me that I love her more than I ever thought possible. When I agreed to this arrangement, I was desperate and thought I had no other options. But these past few days, watching her grow and feeling her respond to my voice, I can't imagine giving her to strangers." "Love is the most important foundation for any child's life," Rebecca said. "Everything else can be learned or built over time. The support services that Agent Kim mentioned can help with the practical aspects of being a single mother." As they talked, Rebecca noticed David Mitchell approaching room 314. His expression was tense and focused, and he carried a car seat and diaper bag, clear indicators that he intended to leave the hospital with the baby. Agent Kim had warned that this moment would be crucial to the success of the operation. "Good morning, Jessica," David said, using Maria's assumed name and maintaining the pretense for anyone who might be listening. "Are you ready? The new parents are waiting, and we need to complete the transfer this morning." Rebecca watched Maria's face as she looked down at her daughter, then back at David. The young woman's internal struggle was visible, and Rebecca could see her gathering courage to make a decision that would change the trajectory of both their lives. "I need to talk to you about something," Maria said quietly. "I don't think I can go through with this. I want to keep my baby." David's expression immediately hardened. "That's not an option," he said firmly. "You signed an agreement. You accepted payment, and you have obligations to fulfill. The buyers have invested significant money in this arrangement, and they're not going to accept disappointment." Rebecca stepped closer to the bed, positioning herself between David and Maria. "Perhaps this conversation should continue in a more private setting," she suggested, hoping to buy time for the federal agents to intervene. "This is private enough," David said sharply. "Jessica needs to understand the consequences of breaking her agreement. There are people involved in this arrangement who don't accept changes to the plan." Agent Kim had been monitoring the situation through surveillance equipment, and Rebecca knew that David's threatening language would provide evidence of coercion. She also knew that federal agents were positioned to intervene as soon as David made any move to take the baby from the hospital. "I understand that I signed papers," Maria said, her voice growing stronger, "but I was desperate when I made that decision. I didn't understand what it would feel like to carry her for 9 months and then hold her after she was born. She's my daughter, and I want to raise her myself." David moved closer to the bed, his tone becoming more menacing. "Your feelings are irrelevant. This baby belongs to the people who paid for her. You're going to hand her over right now, and we're going to walk out of this hospital as planned." Rebecca pressed the emergency call button discreetly, knowing that it would alert security and medical staff to a situation requiring immediate attention. She also positioned herself between David and the baby, drawing on her training in de-escalation techniques. "Sir, I need to ask you to lower your voice," Rebecca said professionally. "This is a medical facility, and we have policies about maintaining a peaceful environment for our patients." David ignored Rebecca and reached toward the baby. "Give her to me now, Jessica. We're leaving." At that moment, Agent Kim and 3 other federal agents entered room 314, identifying themselves and ordering David to step away from the bed. The intervention was swift and professional, designed to minimize trauma for Maria and the baby while securing the evidence needed for prosecution. "David Mitchell, you're under arrest for conspiracy to commit human trafficking and illegal adoption fraud," Agent Kim announced as agents handcuffed him and read him his rights. Rebecca immediately focused on Maria and the baby, both of whom had been startled by the sudden activity but were physically unharmed. "You're safe now," Rebecca told Maria. "Both of you are safe." The arrest of David Mitchell was just the beginning of a coordinated operation that Agent Kim had been planning for weeks. Simultaneous arrests were taking place in Seattle, where Jonathan and Catherine Walsh were being taken into custody for their role in the illegal adoption scheme. Other members of the trafficking network were being arrested in Los Angeles, Phoenix, and Denver as federal agents dismantled the entire operation. Dr. Martinez arrived in room 314 as the federal agents were processing the scene. Her primary concern was ensuring that the medical emergency hadn't disrupted care for any of the NICU patients, including baby girl Santos. "How are our patients doing?" Dr. Martinez asked Rebecca. "Both mother and baby are fine," Rebecca replied. "Maria is shaken but relieved, and the baby slept through most of the excitement." Agent Kim approached Maria's bed once David Mitchell had been removed from the room. "Maria, you're no longer in any danger from the trafficking network. We've arrested the key players, and you're free to make whatever decision you think is best for your daughter's future." Maria looked down at her baby, then at Agent Kim. "I want to keep her. I want to be her mother. But I need help learning how to do that. We have resources available to support you," Agent Kim replied. "Safe housing, healthcare, job training, and childcare assistance. You'll also be eligible for witness protection services if you're willing to testify against the people who exploited you." Rebecca felt a surge of hope as she watched Maria's face light up with the realization that she could choose motherhood without sacrificing her daughter's welfare. The support services that Agent Kim described would provide the foundation for Maria to build a stable life for both of them. Over the next several hours, Rebecca watched as a team of social workers, victim advocates, and federal agents worked to ensure Maria's safety and begin the process of transitioning her from victim to protected witness. The bureaucratic aspects were complex, but the human aspect was simple. A young mother was being given the chance to raise her child with appropriate support. Dr. Martinez officially discharged baby girl Santos. Later that afternoon, with Maria signing the discharge papers under her real name for the first time. The baby's birth certificate would be amended to reflect accurate information, and she would legally become Isabella Santos rather than the nameless commodity she had been intended to be. "What will you name her?" Rebecca asked, as Maria prepared to leave the hospital with her daughter. "Isabella Hope Santos," Maria said without hesitation. "Isabella, for strength and hope, because that's what she represents for both of us." Rebecca felt tears in her eyes as she helped Maria prepare for the transition to a safe house where they would begin their new life together. The past week had been an emotional roller coaster, but it was ending with the best possible outcome for both mother and child. Agent Kim provided Rebecca with updates on the broader investigation as the day progressed. The trafficking network had been operating across 6 states and had been responsible for at least 15 illegal adoptions over the past 2 years. Maria's courage in cooperating with federal authorities would help ensure that other vulnerable women wouldn't be exploited in similar schemes. "Your observations and advocacy made this entire investigation possible," Agent Kim told Rebecca. "Without your professional instincts and willingness to report your concerns, Maria and Isabella might have become just another successful transaction for these criminals." As Rebecca's shift ended, she reflected on the events that had unfolded since she first noticed that something wasn't right with the Henderson family. Her commitment to patient advocacy had led to the protection of a vulnerable infant and the dismantling of a criminal enterprise that had been harming women and children across multiple states. The nursing profession had taught Rebecca that healing extended beyond medical care to include protecting patients from harm and advocating for their welfare in all circumstances. The successful resolution of Isabella Santos's case demonstrated the power of professional vigilance combined with interagency cooperation to achieve justice for those who couldn't protect themselves. As she left the hospital that evening, Rebecca knew that Maria and Isabella faced challenges ahead, but they would face them together with appropriate support and protection. The bond between mother and child that she had witnessed developing over the past few days would be the foundation for whatever came next. The case had reminded Rebecca why she had chosen nursing as her profession. For moments like these, when medical care, professional advocacy, and human compassion combine to change lives in profound and lasting ways. 6 months after Isabella Hope Santos left Sacramento General Hospital in her mother's arms, Rebecca Torres received an invitation that filled her heart with joy. Maria Santos was requesting her presence at Isabella's baptism, a celebration that would mark not just the baby's introduction to her faith community, but also the successful completion of Maria's transition from victim to empowered mother. The journey from that tense morning when federal agents arrested David Mitchell to this moment of celebration had been challenging, but ultimately transformative for both Maria and Isabella. Rebecca had followed their progress through Agent Kim, who had kept in touch to provide updates on the broader investigation and its impact on other victims of the trafficking network. The baptism was held at St. Teresa's Catholic Church in a quiet Sacramento neighborhood, in a community that had embraced Maria and Isabella with open arms. As Rebecca entered the church, she was struck by how different Maria looked: confident, healthy, and radiating the kind of contentment that comes from making peace with difficult decisions. "Rebecca," Maria called out, approaching with Isabella in her arms. The baby had grown considerably and was alert and responsive, clearly thriving under her mother's care. "I'm so glad you could come, Isabella. This is the nurse who helped keep us safe." Rebecca felt tears in her eyes as she looked at the healthy, happy baby who had been at the center of such a complex and dangerous situation. "She's beautiful, Maria. You both look wonderful." "We're doing really well," Maria said, Her English noticeably improved from the classes she had been taking as part of her support program. The transitional housing program helped me find a permanent apartment, and I start nursing school next month. I want to help other women and babies the way you helped us. Rebecca was moved by Maria's decision to pursue nursing, understanding that her traumatic experience had motivated her to become an advocate for vulnerable families. Nursing school is challenging, but I think you'll be excellent at it. Your experience will help you connect with patients in ways that textbook learning never could. The baptism ceremony was beautiful and meaningful, with Isabella wearing a white gown that had been donated by church members who had heard about Maria's story through the Victim Services Program. Father Miguel, who had been providing counseling and spiritual support to Maria, spoke about second chances and the power of community to heal and protect those in need. Agent Kim was also present at the ceremony, having developed a personal investment in Maria and Isabella's welfare that extended beyond her professional responsibilities. During the reception following the baptism, she updated Rebecca on the final outcomes of the trafficking investigation. David Mitchell was sentenced to 15 years in federal prison, Agent Kim reported. Jonathan and Catherine Walsh received 10 years each, and the other members of the network received sentences ranging from 5 to 12 years. The investigation also led to the rescue of 6 other women who were being exploited in similar schemes. Rebecca felt satisfied, knowing that justice had been served, and that other vulnerable women had been protected as a result of the investigation that began with her observations about baby girl Henderson. What about the other babies who were involved in illegal adoptions? Each case was evaluated individually. Agent Kim explained. In some instances, the biological mothers chose to reclaim custody with support services. In others, the children were placed through legitimate adoption agencies with families who had been properly screened. The priority was always the children's safety and welfare. As the reception continued, Rebecca had the opportunity to meet several of the people who had become part of Maria and Isabella's support network. Social worker Patricia Gonzalez had been instrumental in helping Maria navigate the complex process of establishing independent housing and accessing educational opportunities. Maria has been one of our most successful clients, Patricia told Rebecca. Her determination to build a better life for herself and Isabella has been inspiring to watch. She's also become a mentor to other young mothers in our program. Rebecca also met Dr. Sarah Chen, the pediatrician who had been providing Isabella's medical care since she left the hospital. Isabella is developing perfectly, Dr. Chen reported. She's meeting all her milestones, and the bond between her and Maria is strong and healthy. Whatever trauma occurred during the early days of her life hasn't had any lasting impact on her development. The most moving conversation of the day was with Rosa Martinez, an older woman who had become like a grandmother to Isabella. Rosa had lost her own daughter to domestic violence several years earlier and had found healing through volunteering with the Victim Services Program that was supporting Maria. When I first met Maria, she reminded me so much of my daughter, Rosa told Rebecca. Young, scared, but determined to do right by her child. Helping them has helped me process my own grief and find purpose again. Rebecca was struck by how Maria's story had created ripple effects of healing and connection throughout the community. The trauma that had brought Maria and Isabella into the hospital's care had ultimately led to the formation of relationships and support systems that were benefiting multiple families. During a quiet moment, Maria approached Rebecca with Isabella in her arms. I want to thank you again for trusting your instincts and speaking up when you sensed something was wrong. If you hadn't paid attention and asked questions, Isabella and I would be living very different lives right now. I was just doing my job, Rebecca replied modestly. Protecting patients is what nurses are supposed to do. You did more than your job, Maria insisted. You saw us as people who mattered, not just a case to be processed, that made all the difference in how everything turned out. Rebecca reflected on Maria's words as she drove home from the baptism celebration. The case had indeed started with her simply doing her job, observing patient behavior, documenting concerns, and following proper protocols. But Maria was right that something deeper had motivated her persistence in pursuing her suspicions about the Henderson family. The nursing profession had taught Rebecca that every patient deserved advocacy and protection, regardless of their circumstances or the complexity of their situation. Baby girl Henderson had been unable to advocate for herself, and something about Jessica's behavior had suggested that she too might be in need of protection and support. 2 weeks after the baptism, Rebecca received a letter from the California State Board of Nursing, informing her that she had been selected to receive the annual Patient Advocacy Award for her role in protecting Isabella Santos and helping to dismantle the trafficking network. The recognition was meaningful, but Rebecca knew that the real reward was seeing Maria and Isabella thriving together. The letter also mentioned that Maria Santos had applied to the nursing program at Sacramento City College and had listed Rebecca as a reference. Maria's application essay, which was excerpted in the award notification, described her motivation for pursuing nursing as a desire to protect other mothers and babies the way Nurse Torres protected my daughter and me. Rebecca felt a deep sense of professional fulfillment, knowing that her advocacy had not only saved 2 lives, but had also inspired someone to pursue a career dedicated to helping others. The cycle of care and protection would continue through Maria's future work as a nurse. 6 months later, Rebecca was invited to speak at a conference on human trafficking awareness for healthcare professionals. She used Maria and Isabella's story as an example of how medical professionals could recognize and respond to situations involving exploitation and abuse. "The signs aren't always obvious," Rebecca told the audience of nurses, doctors, and social workers. "Sometimes it's just a feeling that something isn't quite right. Our professional training gives us the tools to recognize patterns and inconsistencies, but we have to be willing to trust our instincts and take action even when we can't prove our suspicions." She emphasized the importance of interprofessional collaboration in protecting vulnerable patients. No one discipline has all the skills needed to address complex situations like trafficking. It takes nurses, doctors, social workers, law enforcement, and victim advocates working together to achieve positive outcomes. The conference presentation led to requests for Rebecca to provide training at other hospitals and to consult on developing protocols for identifying potential trafficking victims. Her experience with the Santos case had given her expertise that was valuable to medical facilities across the region. A year after Isabella's baptism, Rebecca received an update from Agent Kim about the broader impact of the trafficking investigation. The prosecution had led to changes in federal law enforcement protocols and had provided evidence that helped investigators in other states identify and dismantle similar networks. The information we gathered from this case has helped us understand how these operations recruit victims and identify buyers, Agent Kim explained. "We've been able to prevent other women from being exploited and other children from being placed in dangerous situations. Most importantly, Agent Kim reported that Maria Santos was excelling in nursing school and had been selected for a competitive internship in pediatric care. She's going to be an excellent nurse," Agent Kim said. "Her personal experience gives her insights that will make her especially effective at recognizing and helping families in crisis." On the 2nd anniversary of Isabella's birth, Rebecca received a photo from Maria showing Isabella taking her first steps. The toddler was healthy, happy, and clearly adored by her mother. The image captured everything that Rebecca loved about nursing, the opportunity to make interventions that had lasting positive impacts on families' lives. Rebecca kept the photo on her desk in the NICU, where it served as a daily reminder of why vigilance and advocacy were essential parts of patient care. Colleagues often asked about the picture, giving Rebecca opportunities to share the story and reinforce the importance of trusting professional instincts when something seemed wrong. The case had also led to improvements in the hospital's protocols for identifying potential trafficking victims. Training programs were implemented to help staff recognize warning signs, and partnerships were established with law enforcement and victim services organizations to ensure rapid response when concerns arose. 3 years after the initial investigation, Rebecca attended Maria's nursing school graduation. Maria had graduated with honors and had already accepted a position in the pediatric unit at UC Davis Medical Center. Isabella, now an energetic 3-year-old, sat proudly in the audience as her mother received her nursing degree. "I want to work with children and families who are facing difficult situations," Maria told Rebecca after the ceremony. "I want to be the kind of nurse who pays attention and speaks up when something doesn't seem right, just like you did for us." Rebecca felt a profound sense of satisfaction knowing that her advocacy had created a ripple effect that would continue to protect vulnerable patients for years to come. Maria's decision to become a pediatric nurse meant that other children would benefit from the insights and compassion that had grown out of her own traumatic experience. As Rebecca watched Maria celebrate with Isabella and their extended support network, she reflected on the remarkable journey that had begun with a baby in the NICU and a nurse's intuition that something was wrong. The case had demonstrated the power of professional vigilance, interagency cooperation, and community support to transform lives and protect the most vulnerable members of society. The story of Isabella Hope Santos had become more than just a successful intervention. It had become a testament to the nursing profession's commitment to advocacy and protection. In the years that followed, Rebecca would continue to use their story to inspire other healthcare professionals to trust their instincts and take action when patients needed protection. Justice had been served, healing had taken place, and a new generation of caregivers had been inspired to continue the work of protecting those who couldn't protect themselves. The bond between Rebecca and the Santos family would endure as a reminder that sometimes the most important nursing interventions happen when professionals are willing to look beyond the obvious and ask the difficult questions that lead to life-changing discoveries. The fluorescent lights of the NICU continued to hum softly, illuminating the work of nurses who understood that their calling extended far beyond medical care to include advocacy, protection, and hope for the future. And in pediatric units across the region, nurses like Maria Santos were carrying forward the legacy of vigilance and care that had saved her and her daughter from a dangerous fate. Love had indeed conquered darkness, truth had set them free, and the healing would continue for generations to come.